Well, in a survey, it was published in the front section of the USA Today, the U.S. Fell to 17th when it came to emotional satisfaction about their lives, which includes health and economics and all that kind of stuff. We're 17th. The top 10, 7 of the top 10 are all from Central and South American countries. Okay? It's kind of interesting. Those people are most satisfied. Interesting also, 2 more in the top 10 were Saudi Arabia and, one other country over in Africa who are very satisfied with their lives, but they're obese. They have a high level of obesity in their culture, and we're wondering if they're really, really satisfied with their lives. Apparently they are, even though they're obese. So it's kind of interesting. At any rate, remember, in healthfulness, we just look at health in general. We rank 92nd. There's 91 other nations whose peoples are healthier than us. We rank 60th in longevity. There's 59 other nations whose peoples live longer than us, and God forgive us. God forgive us. We rank 41st when it comes to live births and first-month survivability of our babies. There's 40 other nations who do a better job of pregnancies and live births and first-month survivability of babies. So, where do we go? This is a mess. Our medical system has failed us terribly. And again, I would urge you to get the 3 books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, Rare Earths, Forbidden Cures, and Immortality. Those 3 books are going to teach you how the top 20 longevity cultures have 40 times, it's hard to say it, 40 times the 100-year-olds we do. They have 100-year-old per 250 of their population. We have 100-year-old per 10,000. We're not even close. 1 per 10,000, they have 1 per 250. It's a huge difference, 40 times. So what I want you to do is, again, get these 3 books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, Rare Earths, Forbidden Cures, and Immortality. And between them, they look at the top 20 longevity cultures, and they identify the 23 common threads these people practice, that you can do the same thing. Now, here's the piece. These people are all illiterate countries, okay? The top 20 longevity cultures are illiterate countries. They are third-world cultures. They don't have amenities. They don't have roads and utilities, no electricity, no propane, no natural gas, none of that kind of stuff. They don't have any cars. They don't have insurance for health, either private or government. They have no doctors, no hospital, no clinics, no emergency services. They don't have that kind of stuff, and yet they have 40 times 100 as we do. Well, that's because they don't even know what they're doing. It's just by dumb luck that they do these things. And, of course, you need the 90 for life. That's part of the deal. Okay, you need 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And the purpose of these nutrients is to maximize your potential, your genetic potential for health and longevity, be able to fend off diseases, decision-making, intelligence, IQ, all that kind of stuff, birth defect-free communities. You're going to have to consciously be obsessive about taking the 90 essential nutrients. Everybody you know, your church mates, your work mates, your immediate family, your extended family, your neighbors. If you don't do these things, it's going to be the biggest mess you've ever seen. Experts are saying our kids will be the first generation that do not live as long as their parents. We're not talking about you dying at 75 and them dying 10 years later at 72. We're talking about you burying your children is what the signal is here. And so you need to get a hold of these 3 books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, Rare Earths, Forbidden Cures, and Immortality, and learn what you need to do to maximize your genetic potential for health, longevity, wellness, being able to have emotional satisfaction, and have good intelligence. So it requires, these 90 essential nutrients are required to fulfill the needs of your genes, your DNA, your RNA, and your telomeres, which are the end caps for your chromosomes. It takes 90 essential nutrients to pull that off. The book Epigenetics, just recently published, is the only book where you're going to find the function of every mineral, every essential mineral, the function of every essential vitamin, every essential amino acid, and every omega-3 essential fatty acids. It tells you what functions they have to support the optimal genetic potential for your genes, your DNA, your RNA, and the telomeres, and it goes through what each one of them does. and it's in very easy language to read. It's not beyond the fifth grade reading level. It's just written so even people with the fifth grade reading level can understand this. And you're going to understand the importance of your genes, your DNA, your RNA. See, everybody in America, I truly believe we have the potential, because many people have done it, recorded and documented. Many people have lived in modern times well beyond 200. 160, 180 should be nothing. But we're not giving our genes and our DNA and our RNA the things they need to pull this off. You have to be obsessive about this. I want you to think about it. A couple of months ago, I turned 75. I have not been to a doctor, with me being a patient, for 68 years. I've never been on prescription medication. And if everybody in America were healthy like me, guess what? The medical system would be a little humble, because their patients would only go to them once every 75 years. Contact your Youngevity associate today and ask for epigenetics, rare earth-been cures, and immortality, and add many healthy years to your life. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about antibiotics, as I've got a ABC News story here, headline, "Despite warnings, antibiotics still overprescribed in kids." And they're talking about the fear that this is going to lead to these superbugs that can't be killed by antibiotics. And researchers at Seattle's Children's Hospital examined past studies from 2001 to 2011 to see how doctors treated common childhood respiratory infections, conditions including sore throats, ear infections, and sinusitis. It found that although only 27.4% of the infections were caused by bacteria and therefore could be treated with an antibiotic, they say 57% of them were actually treated with antibiotics. So close to half, or maybe more than half, were unnecessary. And they say that amounts to 11.4 million unnecessary prescriptions for antibiotics every year. Researchers say these antibiotics are no good against viral infections and have only been shown to work against bacterial infections. The lead author, Dr. Matthew Kronman, a pediatric infectious disease specialist at Children's Hospital, says the results are disheartening. His team found no appreciable change in prescribing rates over the past 10 years. He's quoted as saying, "Whatever we're doing now, it isn't working. We need to come up with a new strategy to understand why this gap exists," referring to the gap between antibiotics needed and those prescribed. According to the American Academy of Pediatrics, they say the top pediatricians group in the United States has periodically given out guidelines for the use of antibiotics. In 2001, they did one for sinusitis, in 2004 for ear infections. He said, but a lot of it is driven by demands from parents as well as doctors that face quickly distinguishing a viral antibacterial infection. Still fuels the trend. Experts say their big fear is there will eventually be no treatment options for superbugs. An estimated 2 million Americans are infected with an antibiotic-resistant organism every year, and that leads to 20,000 deaths, according to a 2013 report from the CDC. And a guy not involved with the study, Dr. Mark Ebel, a family medicine physician and professor at University of Georgia College of Public Health, says for some infections like acute bronchitis, pharyngitis, and negative strep tests and URI, we know that antibiotics do not help you get any better, faster, and are not needed. So once again, you've been told and told, stop using the antibiotics, and they still want to continue doing it, and I suspect that it is because of the cha-ching factor.
You're exactly right, Doug. What happens here is the doctors know that the antibiotics are not going to work on viruses. They are not stupid. They know that. But they are not going to say, oh, go get Wallach's Colloidal Silver. Go get Wallach's PureWorks soap, lotions, and foams and sprays. And, disinfect your skin. Use the aromatherapy oils. Ravenser for respiratory infections. Use our trauma oil for pain. They're not going to do that because you can get that from us without a prescription. And so when they give an antibiotic, is to keep the patient in his envelope, so to speak. Okay, well, I have to have this prescription antibiotic. Okay, and so that's why they do that. They know it's not going to work, but they use it as a tool to keep reeling in that patient, keep reeling them in. Yes, you need this antibiotic. It's by prescription only, don't forget. Mm-hmm. And so this is why people have to, again, get a hold of the book Epigenetics, get a hold of the book, the trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport Aromatherapy, and learn how to take care of yourself. Why would you depend on a group of people who kills, injures, and infects 15 million of their customers every year in their workplace? Hello? Great one, Doug. And we'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, I think you have an announcement before we go to caller.
I certainly do, and we'll start out with this. Because this is well-deserved. Today is the 18th anniversary of this show going as a 5-day-a-week show. Previously, for the first couple of years, we were just on 1 day a week, and we elected to go at noon 5 days a week 18 years ago today. So congratulations, Doc.
Well, happy birthday to you, too, because you've been a big part of it.
I didn't join the show for another year or so, though.
I know, but you've been a big part for 17 years, right?
Yeah, I have been.
Yeah, and, of course, Michael, the syndicator, right, so ZBS, so we want to thank him for all the great things he's done to help put this show together and keep moving us forward and get us involved with GCN, Genesis Communication Network. Now we're available through 1,300 stations, so we're really, really excited. Great job, Doug. Great job, Michael. And let's go to callers.
All right, let's head to Los Angeles, California. And Robert, you're on with Dr. Wallach.
Hello, Robert. You're on the air.
Hi, Dr. Wallach.
Yes, sir. How can we help you?
I have a friend of a friend that's 32 years old, 5 feet 2 inches, 165 pounds. She was 15 or 16 weeks pregnant last week. So, yeah, 1 more week, I guess, 2 weeks ago. Has been told that the baby shows that he's going to be born with Down syndrome. The baby has 100 beats per minute, and they detected that she has a low protein that gives oxygen to nurture the baby through the placenta. I'm not really sure what that means.
Okay, well, it's a very interesting situation because if you remember the great daredevil, Evel Knievel, his niece-in-law called me at 2.5 months of pregnancy, which is 10 weeks, right? In the 4 months, or 4 weeks, and 2 weeks. It was 10 weeks of pregnancy, and she had Down syndrome baby by amniocentesis, by actual cells observed from taking the fluid from the amniotic sac, and also by ultrasound. 2 different tests, 2 different labs. Neither one knew that the other lab had diagnosed the baby with Down syndrome. And we put on a program, and the baby was born full term, perfectly normal. It did not have Down syndrome when the baby was born. We know that Down syndrome occurs in the first duplication after sperm fertilize the egg when the mother is deficient in zinc. It's a zinc deficiency in the first duplication. And apparently, and I've done this several times since then, apparently in the earliest stages of pregnancy, Down syndrome may be reversible, because they haven't done it in a laboratory setting in humans, in animals, yes, but not humans. So hang on, we'll give you a program, this lady, and you have everything to gain, nothing to lose by trying it. We'll be back after these messages. Okay, Doug, we're going right back to California, and Robert. Okay, at 165 pounds, I would give this lady one of the Healthy Brain and Heart packs per month, 1 Healthy Brain and Heart pack per month, take a full dose of everything at breakfast, and also I'd have her take 1 ounce at dinner time of our Ultimate Classic. And let's see here. I would also have her take the hair, skin, and nails, which gives some little bit of weird stuff. I believe is very useful. And I would also give her 2 of our Immortalium, 2 Immortalium tablets at breakfast and to a dinner, be 1 bottle a month. Keep her away from all the bad stuff. No fried foods, no processed meats with nitrates, nitrites. It means no deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami. Absolutely no oils. It means no olive oil, no coconut oil, and no margarines, mayonnaise, salad dressing, and cooking oils, and then absolutely no gluten, no wheat, barley, rye, and oats. Okay? And this can be a process here. And as things go along, let me know. Obviously, they oftentimes will have a heart defect, and this may be, the reason why there may be some interest in the baby's heart. Okay? And so give me a call every couple of weeks and let me know how this baby's doing. Every time she goes for an exam, let me know what the doctor says. Okay, Doug, we have time to start another one?
We certainly do. Let's head to Philip in Houston, Texas. You're on with Dr. Wallach.
Hello, Philip. You're on the air.
Thank you, Doctor, for taking my call.
Yes, sir. What's up?
I've got 3 issues here. I'm in quite a bit of pain on my hips, but I have had AFib, so I'm taking 3 medicines for my AFib.
Mm-hmm.
I had back surgery about 6 months ago, and 6 weeks ago.
Okay, what did you have the back surgery for?
I had a bulging disc.
Okay.
That was pushing on my spinal cord.
Okay, where at? Was it in your upper back or lower back?
Lower back
Okay.
between 4 and 5.
Okay.
And I had let's see. Oh, okay, and I'm also taking Fanacinic for enlarged prostate. And
Okay.
so, and then the last one I have is I'm having hip pain on both hips, and I had it x-rayed, and they said they didn't see anything wrong with it, but I don't know whether they're telling me the truth or not.
Sure. Okay, well, it could be, Phil, that you have some loss of cartilage in there that they're not able to measure correctly. You could have a sciatica problem where you're getting pain in your hips is caused by the back problem, the surgery. We come back. This is a Shar thing. It's a Shar prepare for this because when we come back, I'm going to throw it to you and let you tell Philip what he needs. We'll be back after these messages. Okay, Doug, let's go right back to Texas. I do need to ask Philip one question here. Philip, do you have any idea how much you weigh? What is your body weight?
I'm a male, 70 years of age, 312 pounds, and 6'2". And I've been working trying to lose weight and haven't had any results.
Sure, we'll be able to help you with that. Okay, Shar.
Yes.
Okay, we got a 312-pound guy, 70 years old. He got prostate problems, got back problems, atrial fibrillation, pain in his hips. And what do you say?
I think he needs 3 healthy bone and joint packs, and he needs ProstFX for the prostate problem. But the AFib is all caused by the same thing as the other, the bulging disc and everything. It's the glucogel.
Very good. What would you do for his weight?
I would get him on the ASAP.
ASAP, yeah. He's 6 foot. I want him to weigh 200 pounds, so he needs to lose about 112 pounds. Okay, very good. You get an A+, Shar. Okay, Philip, you need 3 of the Healthy Bone and Joint packs. That'll be 1 ounce of the OsteoFX Plus at breakfast, lunch, and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast, lunch, and dinner, 3 of the EFA Plus at breakfast, lunch, and dinner, and 20 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime with a glass of water. All that will be accomplished by the 3 Healthy Bone and Joint packs per month. For the prostate, I'd go ahead and get your, and this goes by body weight too, so once you get 3 bottles of the ProstFX per month, and you'll be able to take 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. They're designed to support and promote healthy prostate size and function. And then the AFib, as Shar pointed out, this is due to constriction of the roots of the spinal nerves that actually control the rate and rhythm of the heart. When you have degenerative disc disease, which we know you have because you had back surgery for it. Okay? So I would also throw in one more thing here. It would be Bone Builder. I want you to get 3 bottles a month of the Bone Builder, so you can take 9 of those a day, 3 at breakfast, 3 at lunch, 3 at dinner. And on the ASAP, I want you to get 2 bottles a month. I want you to take a dropper full, not a drop, but a dropper full under your tongue 30 minutes before each meal, and a dropper full under your tongue 15 minutes before each meal. So you're going to have 2 droppers full before each meal, 1 dropper full 30 minutes before the meal, and 1 dropper full 15 minutes before the meal. Let it absorb through your oral tissues. Do not swallow it. It might take a minute or so for that to happen. And then call us every week. We're going to want to know your body weight. We want to know your blood pressure, your pulse, how, if you're getting up at night to urinate. And we want to know, certainly, your weight and your blood pressure. Let us know how the AFib stuff is going. You can get actually pretty good results very quickly. Wouldn't hurt to take the 3 bone and joint packs. In each one, you're going to get a wide mouth jar full of CM cream. Get somebody to rub that on your upper back. A nice big teaspoonful of it between where your neck joins your back and down to your 4th vertebrae in your upper back. So T1, 2, 3, and 4. Put that teaspoon of the CM cream on there, and it can reduce the swelling and inflammation around the roots of those spinal nerves coming out from between T1, 2, 3, and 4. And may give you some temporary relief until we actually are able to repair the problem by supporting and promoting maintenance repair of these discs, the bones, help you with that weight loss. Don't forget the ASAP, and give us a call, and we'll walk you through this. This is all resolvable with this program. Okay, Doug, we have time to start another one.
We certainly do. Let's head to Colorado. And Sherry, you're on with Dr. Wallach.
Good
Hello,
afternoon,
Sherry, you're on the air. Hi.
Good afternoon. I have a person who had gotten a recipe from you. She's 67 years old, a little under 5'1" due to scoliosis from the time that she was 12, 114 pounds. You started her on the Healthy Bone and Joint plus bone building and extra OsteoFX. Mm-hmm. And she has 3 issues. She has a bladder diagnosis of non-infectious cystosis or cystitis, that she was taking a product called Pre-Leaf over the counter. By the way, she's on no prescription drugs. And that helped to remove the acid from food. Since she stopped taking that, she has now her sense of urgency returned. So she's asking about going back on that. She also is taking a product for bone health called Fosamax.
No, you got to get off of Fosamax. Fosamax results in fractures. Yeah, Fosamax is not an acceptable drug to take. Produces bone fractures.
Okay, and that, of course, is over the counter as well. And then her big concern, and we can go back to the Pre-Leaf in a minute, but her big concern is the amount of calcium, because she's taking now over 5,000 milligrams of calcium, has read that more than 1,200 milligrams could be a problem, and wants to make sure they will not cause kidney problems.
Not going to cause kidney problems or kidney stones, but I want to go to this bladder problem. Shar, what's causing this lady's bladder problem? They couldn't culture a bug, but she still has urgency, maybe even incontinence, where she may be dribbling and peeing in her pants a little bit. So what would you think if they can't get a bug, and she's had this for some time, what would you think that's associated with?
It's like muscular dystrophy of the area there.
Well, it could be a muscular dystrophy type of thing, or a fibromyalgia of the bladder muscle. That's true. That's a possibility. But also, it's a peripheral neuropathy. Just like people get sciatica, just like people get atrial fibrillation, the internal branches of the sciatic nerve control the bladder. And people will be walking down the street, and all of a sudden they step up a curb or down a curb, and they go, "Oh God, I just peed in my pants. I didn't even know I had to go to the bathroom." And that's due to degenerative disc disease when in the external branches of those sciatic nerves get pinched. They get sciatica, pain down their hips and legs, tingling, numbness. When they get the internal branches being pinched, they get a bladder urgency. They'll get incontinence where they're peeing in their pants. They'll get irritable bladder syndrome. A lot of doctors will diagnose this as UTI, even though they can't culture anything. There's no bugs. They'll diagnose it as an urinary tract infection because they will have burning on urination. And again, she should use the CM cream from the Healthy Bone and Joint Pack. She can use that CM cream on her lumbar area to relieve the inflammation and pain associated with squeezing the roots of that nerve. And you do this, if she does this faithfully, including those bone builders, this will support and promote maintenance repair of the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And the bladder problem will rather quickly, usually within a couple of weeks, 10 days, couple of weeks, go away. My favorite commercial on TV, Shar, is that one where the bladder is dragging the woman around. Her urinary bladder is dragging around out of the bus because there's a bathroom.
Yep.
And they say, urgency, you have incontinence, burning on urination. It's a back problem. And just like you hit a peripheral neuropathy, AFib, it goes to the other end, too, with the urinary bladder. So give us a call every couple of weeks, Sherry, when your friend actually deals with the problem, and we'll walk you gals through this. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to Houston, Texas. And Mary, you're on with Dr. Wallach.
Well, Mary, you're on the air.
Oh, wonderful. My question is, I had a TIF surgery back in June of 2013, and
You have to tell me what that is. What is a TIS surgery?
Okay. Oh, I'm sorry. It's a transoral incisionless fundoplication. It's basically, I think they rebuild where the acid won't go up into, I guess, your esophagus, and where it won't, cause you to have
reflux.
Heartburn. Reflux, exactly. And I didn't really realize what I was doing. Had I realized that, I really wouldn't have done it. I was just thinking they were going to fix something that was wrong. I didn't really know, and that's my fault.
Yeah. But just for all our listeners, that certainly is not going to fix the problem, as you've learned.
No. Please don't ever have one. Please. Please.
Okay, so how much do you weigh?
Well, now I'm overweight. That's another thing. I've gained weight. I'm now 199. I've never been that. I've always been 130.
How tall are you?
5'4". Well, really, a little shorter. Probably 5'3".
Do you have any other issues? Any diabetes or high blood pressure, arthritis?
No, I have experienced high blood pressure a couple of times since this, and my blood pressure was real low the other night.
Okay, here we go. We got to go faster here, dear. Okay, got your pen and paper?
Yes.
Okay, so what I want you to do is this goes by body weight, and we'll reduce things as you get lighter, and you will. I want you to get 2 of the healthy digestive packs. I want you to be able to take our Ultimate Enzymes, take 2 of those 2 to 5 minutes before each meal with a couple ounces of water, and take all the supplements in the healthy digestive pack, full dose of everything at breakfast, full dose at dinner time. I also want you to get our peppermint oil, our Ancient Legacy peppermint oil. Put 4 drops of peppermint oil in an 8-ounce cup of warm water before each meal, and sip on that throughout the meal. Whatever you got left over at the end, just knock that down, just clunk, just smash it down, but sip on it through the meal. And then I would also, let's see here, for the weight, I would have you take, Char, what would you do for the weight?
ASAP.
ASAP, well, there you go. I'd go ahead and at 5'4", 130 pounds, it'd probably be about right, 125 to 130 pounds. So I'd want you to lose 60 pounds. I'd go ahead and get 1 bottle of the ASAP, as Char suggests. Go ahead and take a dropper full under your tongue 30 minutes before each meal, and you will begin to lose the weight. And as you lose the weight, to call us every couple of weeks. Let us know your weight, your blood pressure, your pulse, kind of stuff. And between the healthy digestive packs, the 2 healthy digestive packs, and I would go ahead and get 2 bottles of the Ancient Legacy peppermint oil. And Char, you've seen reflux and heartburn go away in seconds, haven't you, with the peppermint oil?
I absolutely have, yep.
And this is people who've had terrible problems for 12 years. I mean, really serious disruptive problems. And
burping and belching every 10 seconds.
Yep. And then how long did it take to get rid of the symptoms?
About 10 seconds.
10 seconds after 12 years of suffering, day and night.
Yep.
And so the Ancient Legacy peppermint oil is really a good relief program when you have heartburn and reflux. But you have to stay away from all the bad stuff. That means no carbonated drinks, certainly no, do not take any alkaline waters during meals. You can take them between the meals, but not during meals. I would also salt your food significantly, because when you have reflux, it's not acid reflux, it's due to the lack of stomach acid, and salt is the raw material for the chief cells in your stomach to make stomach acid. You sterilize your stomach, no more yeast and bacteria growing, no more reflux. It's that simple. Okay?
Okay, just my very main question was I wanted to have this reversed. If I have it reversed, can my barriers rebuild, or is that something that's destroyed forever?
That I don't know. I have no experience with that procedure, and you'd have to get information from 3 or 4. I would get information and input from 3 or 4 different gastroenterologists to find out the answer to that question. Well, thank you, Char. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.